welcome to the Khayal Clubhouse.
Yes, yeah.
Today, like we had promised you, we have Dr. Vijay Surase who's with us, and he is going to have a webinar and a talk with us, heart to heart for heart. Okay, and I just would like to introduce Doctor to you. Dr. Surase has been an interventionalist cardiologist with Jupiter Hospital from the very inception of Jupiter Hospital, and he's been practicing as a cardiologist for the more than a decade now. He's also been appointed as an honorary consultant cardiologist to the governor of Maharashtra and the Mantralaya.
Oh.
Now, he has worked on more than 20,000 procedures in the last 10 years. So he's been a very, very busy man, and he has had a busy day today, but he has taken the time out to speak to us. Hi, good evening, doctor, and thank you for coming here and spending some time with us. We are all the members of the Khayal Clubhouse. Most of us, about 60, all senior citizens, very excited to meet you and have a lot of questions to ask you too.
Thank you so much. Thank you, Marvin. I think we have 18 participants and 4 or 5 of us are so-called committee members.
Yes. So it's me, Vikas from Khayal, there's Mervin, we have Raisa, we also have a technical team, Rasika, all of us, and our Khayal Clubhouse members. We meet every Saturday at 5:30. So we have different sessions. We meet online. Today we are having a session with you. The week before we had a session with a dietitian. Sometimes we have something little which is not serious, like we have games, we have activities which are to improve the cognitive skills.
Got yours?
Different things.
Yes, Raisa told me. So you want me to start?
Yes.
Actually, huh?
Yes, you can go ahead.
So there will be people who will be joining in between?
They'll keep on joining.
Okay.
Yeah, Rasika.
Alan is there.
Okay. Good evening, everybody. This is Saturday evening.
Good evening.
Yeah. So thanks to technological advancement and science, we are getting connected to each other physically, though are miles apart. People are sitting in their own bedrooms, own drawing room, own hall offices. This is the beauty of the technology, which actually I am not very good at using this technology, but this is a need of the time. Science has helped us throughout. And if you Google out what is the life expectancy of the average Indian today, it is something like 69.33 years. And if you also Google out what was the life expectancy pre-independence in India for an average Indian, it was merely 32 years. So why this is the difference which has been seen earlier? It was just merely 32 years and now 69 years. And I hope in this coming decade, the average Indian is going to survive at least 75 to 80 years. Average Indian, people must surpass that age. And this is all thanks to science and technology again. There were infectious diseases in the past. Now there are lifestyle diseases which are taking a toll on life. Whatever you do, you may spend your life in the Himalayas like a yogic person. You may meditate, you may be on a good diet, do exercise. You're not going to survive 200 years or 150 years. Lucky ones may reach a century like Sachin Tendulkar. You can score a century. Of course, then we'll have to give again credit to your own lifestyle plus science. The medicine has progressed over the last few decades, and this is where we are. Now, as an interventionist, my name, I think you pronounced a little wrong. My name is Vijay Surase, S-U-R-A-S-E, Surase. And I'm a cardiologist practicing last 22 years. Last 14 years, I have been at Jupiter Hospital, Thane. Today, I'm going to touch base on certain important aspects of heart. Plus, half of my discussion will be my own observational studies and my own observational things, which I feel can help the people above age of 60. We call people above 75 as elders. So I still call people in age group of 60 to 75 as young. So this is the second school of youngs, or this is the second inning youngster game which you are playing. Those who are 60 plus and retired from their different professional services, every day when you get up early morning, you should thank God, pray that you have got a very good quality of life so far. And you should ask God that till your last breath, you should get good quality of life. You should not be bedbound, not be sick in the ICU, not receiving any treatment in a super intensive care. So you should be thanking God. And for further on to live a quality life, you have never suffered this problem, or those who have suffered and come out of this, I'm going to give you certain tidbits. Now, here is the model of the heart. This is incidentally here in the OPD office of mine. So I'm utilizing all those resources which I have. We are going to center stage our discussion around this heart. Mumbaikars are aware that there are three lines: Central Line, Harbour Line, and Western Line. So my discussion is going to be focused around these three lines: Central Line, Harbour Line, and Western Line. These are not the lines which are railway lines, but these are the lines of the heart. Now, the front line of the heart is called a central line. It is an important blood vessel that is called a LAD. Back going is one of the line that is called as onto the back surface is one of the line. It goes from here like this. It goes from here and goes to the back. It is a Harbour line, that is circumflex artery. And one line which goes onto the right side of the heart is called as Western line or the right coronary artery. The diagrammatically on this screen, it might appear a little different, but let me place it here. This is my left hand. The artery which runs like this is the LAD. The artery which runs onto the right side is the right coronary artery. Artery which goes onto the hind surface is the circumflex. So the basic discussion will be centered around these three lines and certain important things which you should understand. To keep your heart healthy, you have read, you have understood, people have told, you have discussed, there are a lot of information which are being passed on WhatsApp. But in nutshell, I tell people that follow a protein-centric diet. Reduce your carbohydrates, which will take care of your diabetes, which will take care of your obesity or weight, which will take care of your blood pressure. If you take more of proteins in your diet, unless told by your doctor not to consume more proteins, you should be consuming more proteins. Most of the Indians, 98% of the Indians are having deficiency of proteins, vitamin D3, vitamin B12. Now, our body to function well and our body to recover from illnesses, we require good nitrogen balance or good proteins in our body. And that is where the immunity comes from. Proteins are the ones which give us immunity. Immunity is in the form of two. One is chemical immunity, second is cellular immunity. Chemicals are the certain antibodies in our body. We should thank our parents for that. We should thank that they gave us vaccination of different forms, oral polio vaccines, DPT, hepatitis vaccine during our childhood, and we had taken booster dosages. So this has built up our cellular plus humoral immunity or chemical immunity and cellular immunity. But to maintain good immunity, we require good protein intake all throughout your life. If you purchase a vehicle, you just don't fill diesel or petrol and run. You require clutch oil, you require engine oil, you require brake oil, you require steering oil, different things. Similarly, if you eat food, that is not sufficient. You have to consume good much quantity of vitamin D3, good much quantity of vitamin B complex, good much quantity of micro elements which are required like selenium, chromium, zinc, iron. All these things are important for efficient running of our body. Then only our body efficiency will be good and you can work without exhaustion and fatigue for hours together and have a good performance from your body. Now, what is heart disease? Heart disease is multidimensional. Sometimes a child is born with a defect in the heart, hole in the heart, defect with the valve. Sometimes the heart pumping with a child born is less, that is cardiomyopathy. I'm not going to talk about that subset, that is congenital heart disease you are born with. I'm going to base my discussion for 3 minutes on acquired heart diseases because of the lifestyle. Now, what happens is when we advance in our age, this is what happens. The deposition of the lipids inside our heart vessels. This is called as atherosclerotic deposition of the lipids in our heart. The aggression of the formation of the cholesterol and deposition happens in smokers, those who have sedentary lifestyle, those who have diabetes, those who are hypertensive, those who don't exercise, those who consume less of proteins, those who consume more of fat, more of carbohydrate diet. And there are certain factors which contribute to development of this kind of internal speed breakers inside the vessels, which are central line, harbor line, and western line. Wherever the speed breakers are developed, there will be traffic jam. Wherever there is traffic jam, there is chaos. There are accidents. Now, one accident with the heart is heart attack. Clogging of the blood circulation in any of the artery all of a sudden causes heart attack. Heart attack will give classical symptoms, presentation. The pain or discomfort is in the chest center. People come to me, almost 25% of the attendees of my OPDs are for non-cardiac reason. They come out of panic, out of anxiety, IT professional, or those who are Googlers, those who do their diagnosis on Google. They come with the bunch of the investigation report for the second opinion. I call second opinion because Google has already given them first opinion and they have diagnosed themselves. So these people, those who come to me are mostly for non-cardiac pain. They come to me, Doctor साहब मुझे left side को बहुत pain हो रहा है. I feel as if there is a pin prick, stabbing feeling on the left side. I feel left shoulder pain. I feel left arm pain. I feel some pain in the one point over the heart. These are non-cardiac pains. So first important take-home message is all the pains which can be located with a finger by a person are never cardiac pains. Those pains where you require to place a hand, डॉक्टर साहब मुझे कुछ तो भी हो रहा है, ऐसे लग रहा है जैसे प्रेशर रखा है, ऐसे लग रहा है जैसे somebody has kept some weight on my chest. I feel as if somebody is choking me. I feel as if somebody is holding my both shoulders. And especially when I walk hurriedly, when I try to catch bus or train, I feel this. But when I stand, I get relief. So this is angina or this is cardiac pain. So second take-home message is what is the cardiac origin pain? First take-home message was what is non-cardiac pain? Third, as I told first, the reasons for development of clogging of the central line, harbor line, and western line. Fourth, what is heart attack? Heart attack is sudden clot formation in the blood vessels. Not everyone gets a heart attack. Important message. There are people who come to us with a completely clogged artery and they don't suffer from heart attack. What is the reason? Now, if you develop the block inside the blood vessels, all of a sudden, then the heart is not prepared to take up that. There are no collateral formation. There is no balance established and the heart suffers an insult. That is a heart attack. But the block process happens over a period of years and years and years. Then there may be 100% block, but there will be good collateral channels formed from elsewhere. Suppose this artery is jammed, completely jammed here. This vessel is jammed completely. So it is jammed over a period of decades. Then what happens is the other artery from the other place gives good collateral channels. A dense meshworks develop underneath the heart muscles. And this dense vessel network helps this area provide the nutrients, oxygen, glucose, and all those things which are required. So one important message which I've given is if the block happens, all of a sudden heart attack happens. If the blocks happen over a period of a number of years, even though it is 100% block, you don't suffer from the heart attack. You don't suffer from a heart attack. Now, for those people who don't have this kind of heart attack presentation, they also should take medications. There are certain sets of standard medications which you should follow. Some blood thinners, some cholesterol reducing drugs, some drugs which help control your blood pressure, some medicines to help control your pulse rate, medicines to control your diabetes. All these are must. All these are important. People ask me, doctor, what is the need of medicines? I tell them that if you follow good scientific treatment, this treatment are going to help you live longer, good quality of life. People ask me, doctor, do I have to do angioplasty, bypass in such situation? Can't I go just on naturopathy? Can't I just go on medicines? There are certain situations which can be managed on medicines. We tell them, we advise them. But there are certain situations where the blocks are just almost on the verge of development of heart attack. Those need angioplasty, those need treatment in the form of intervention. There will be definitely change of quality of life if the interventions are offered. Now, those people who don't have complaints like chest heaviness, breathing difficulty, they can walk with ease, they can walk for kilometers without stopping, and they have blocks. They don't need angioplasty or bypass. So we base our call on the basis of their performance, their complaints, their clinical evaluation. Our call is not on the basis of blocks. Where the blocks are situated, what is the percentage of block is important, but what is important is what are their symptoms. We base our clinical judgment on the basis of their presentations. Asymptomatic, no symptoms, no aggressive treatment, just lifestyle modification and medicines, and stay under medical vigil. Visit the doctor every 6 monthly or yearly for update on your medicines. Now, what is angioplasty? Angioplasty is placing the stents. Now, here is the model. Those people who have critical vessel block, which present with jaw choking, pain if you walk yardstick distance, unable to do your activities in daily routine, those are the people who are offered this kinds of treatment, that is angioplasty, placing the stents inside the blood vessels. Now, these are the skilled procedures, and interventional cardiologists who have experience, they do this. We enter through the hand route or we enter through the groin route. We first diagnose where the blocks are, what is the percentage of block, and if the blocks are negotiable by stent, we come out and tell. We don't play in disguise. We just don't do anything inside and come out and tell them. We first diagnose, come out and discuss pros and cons, ifs and buts, advantages, disadvantages. Everything is discussed. What is best treatment modality number 1? What is treatment modality number 2? What is treatment modality number 3? Why should you choose treatment modality number 1? We tell them pros and cons about all the treatment, and what if it was my father, I would have done. We always keep ourselves in their shoes and tell them. So we apply science, plus there is a lot of heart team effort. Means it is not a single person's opinion. When we come out with an opinion, there is a team which comes out in the hospitals like the tertiary care center like this with ethics committee. Oh, you should undergo bypass surgery. I think you should, or a team feels that you should undergo 2 vessels treatment for angioplasty stenting. So this is the treatment which is offered after a heart team discussion. Now, more emphasis should be on when we tell patients this block should not develop. More emphasis should be on prevention. So our discussions these days are, because India is a heavily populated country, there is a dearth of good institution, there is a dearth of good doctors. In this pandemic experience, there was dearth of getting beds, oxygen, and all these things. And now hypertension, diabetic heart disease is also pandemic. The world over, the number of patients are increasing. It is so difficult to manage 50 patients in the outpatient department doing 10 procedures. We don't feel happy about. We feel happy offering treatment when the patient comes in agony, when a patient comes in pain and gets relieved of this and goes home happily with good quality of life. But we want that these people who come to us should not require this treatment, because there is a huge cost associated with this treatment. Almost angioplasty or bypass surgery takes you your bill to the tune of lakhs, 3 lakhs, 4 lakhs, 5 lakhs. It depends on what is your general condition, what are the other complications and all. So this was something which was related to the heart angioplasty. Now there is a second subset which I want to discuss about. I'll quote one simple example. When I was a small child, we had gone to Siliguri. When I was a small child, our train was moving very slowly, and at one particular spot, it had stopped. I asked my father why the train had stopped. My father said, "Beta, this is a steep slope. And second thing is the engine which is ahead is insufficient to pull the train. So the government has a special machinery. They are putting a second engine behind." So this is how the railway department handles, beta. They, wherever the places there is a requirement of second engine, they provide with the second engine, especially, and once you achieve a platform, then the second engine is taken off. Now, heart also in certain situations requires a second engine. So second thing which people don't know and should be knowing is people, especially above 60 years of age, they should be aware of this instrument called as pacemaker. Now, whenever the heart, the electrical current in the heart is unable to generate heart beats at a rate which is required by the human body to supply blood to brain and all the organs, then we say that electrical conduction system is failing, or heart block, electrical block is happening. So what we do is, whenever the heart rate goes below the rate of 50, we introduce this instrument in the treatment protocol. This is available in our armamentarium, and we do day in, day out in the cardiac catheterization laboratory. This is a detachable leads. We fix 2 leads, 3 leads. This is a jumbo engine which is fixed to the heart by cardiac surgeon and cardiologist as a team. Now, when a person develops a very much low heart rate, what happens is person falls unconscious, and there may be convulsions or seizures. On the roadside, what Indians do, what our Hindi movies have taught us is, you remove your chappal and put at the nose of the person, or you take an onion and ask the person to smell the onion. This is the Indian movie which is taught. This is not seen in Hollywood movies, though our movies are improvising, they are teaching good science. But more needs to be told to the citizens, nationals, that this is not a modality of treatment to treat a person who has had a seizure disorder roadside. Don't take video, don't take photographs, try to help. Ask the person to turn on left side. If person is not conscious, then you turn the person on the left side, because the vomitus and cough and sputum or the secretions may go into the windpipe and person may have a disastrous life or death also. Turn the person to left side. If the person is convulsing, then try to put something which is non-traumatic, like cushions of your vehicle, pillows, or something like blanket, so that the person does not get injured. So not all the jhatkas which you see roadside are because of the brain disorders called as epilepsy. They could be also because of the conduction system failure of the heart, needing pacemaker implants. Now these instruments, one instrument I have told you, this is a pacemaker. There is another smart instrument which is given to patient. This is called as CRT device. Now there is a second pathology in which the heart rate goes very high. Now heart is a pump. It pumps at a rate of 70 to 100 beats per minute. Whenever wanted, heart should increase the pulse rate, especially you're jogging, running. When you are sleeping, heart should function at a rate of 60 to 70. But when you are sleeping and your heart is functioning at a rate of 250, that is odd. When you are walking, running, your heart is functioning at a rate of 35, that is odd. Both the extremes are odd. Now, when the heart is supposed to increase the rate, it is not increasing, you require pacemaker. When the heart is unnecessarily firing more impulses and heart is not pumping actually, but it is just moving like this, trembling, then also you develop giddy spell, blackout, you fall unconscious and you develop jhatka. So both the extremes of the heart rate cause the same presentation, blackout, fall and jhatka. People may not get this kind of seizure disorder, but they may just fall unconscious, frothing at the nose, breathing stops, and some people, surprisingly, they regain consciousness and heart starts functioning again. Oh, nothing has happened. Where am I? But take you to the hospital, take you to the hospital, people say, and people dump that person into a rickshaw or somewhere. Or if some caretaker comes in, because nobody has time. Such people should be taken to the nearest possible hospital. ECG should be taken. The specialty team should address. If the relative reaches on site, always inquire for neuro assessment and cardiac assessment in such situations. There may be brain disorder also, or there may be a pacemaker related issue. So the fifth point which you have covered is about pacemaker or a jumbo engine and a smart device which is to treat inside the heart when the heart rate goes unnecessarily high. This is called as pacemaker. This is called as CRT or ICD device. Our most of the serials, TV serials or Hindi cinemas or local cinemas have shown people in the emergency ICU, they get cardiac arrest and over the blanket they give shock. And the doctor just removes the mask and says, I'm sorry. Then the family members, they cry out and all. This is not the usual scene what we see. The shocks are not given over the blanket and we try for at least 1 hour resuscitation. You have actually heard about CPR. So I'm not going to talk much about CPR. My colleague, Dr. Saud, had spoken to you about CPR when it is required. A roadside patient or in your society, if a person falls unconscious without heartbeats, without respiration, CPR. Every citizen, I had actually practiced in US in Cleveland Clinic Foundation 2001, I was there. Every person is having a compulsory requirement to pass their college is CPR training. In Europe, every person should undergo military training is the compulsory norm. Over here in India, there is no such compulsion. We enjoy luxury of life, calling ourselves as good citizens, good Samaritans, but we don't know what CPR means and how to protect our fellow nationals. We are not aware of this, but this definitely will add to inputs and will give you knowledge that there are certain treatments like this. Now, this was something which was related to heart blocks, electrical blocks, angioplasty, pacemaker, ICD. There is a modality of treatment called as bypass surgery. When do doctors do bypass surgery? When there are blocks which are complex, which cannot be managed by angioplasty, cannot be managed by just medicines, and patient gets agonizing pain, chest pain, breathing difficulty, having limitations of doing activity. then surgical treatment is offered. Bypass is like construction of flyover. Wherever there are traffic jam, government widens the road. So first widening job is done by us, interventional cardiologists. Widen the road by placing the stent. Ease the arteries out. But wherever the widening of the road is not possible, which is the common scenario in India, but it is difficult to construct flyover also, but wherever need be, flyover constructions are done. So surgeons do the flyover construction. What the surgeon does is, you can see this heart. Suppose there is critical block here, critical block in this artery, critical block in the hyoid artery. What a surgeon does is constructs a tube which connects from here to the artery down, constructs a tube from here, connects from here to here, constructs a tube from here to here. Now the raw material which is used in constructing the tube is God-gifted arteries inside our body. Our God Almighty, the architect of our body, has given so many extra arteries and veins that human body can have 3 bypasses in the entire lifetime. So these conduits or the vessels are used inside the human body by the surgeon to construct the flyovers. So from here to here, from here to here, from here to here, the surgeon gives 3 flyovers, 4 flyovers to bypass the traffic jams or blocks. So this is called as open heart surgery or coronary artery bypass surgery. Now there are new modalities of treatment which are coming. I'll just touch base. Now we have heard that we have crossed almost 125 heart transplant in Mumbai. There are certain treatment where we don't open the heart, but we do wall replacement through the groin. There are certain treatments where we replace the valve through the groin without opening the chest. These are the novel treatment. There are different names like TAVR, PTMVR. We seal the hole inside the child's heart by placing a buttonhole sandwich devices. So new treatment modalities are available. It is better to consult, which is case-based consultation with a specialist, and understand the newer technological advancement can definitely give good quality of life. So this was the first part of my discussion. Second part is more important for me. Now, head to toe, human body should be respected. It is just not heart. Now, let me address first for the eyes. 60+ people will have visual problem. If your vision in the daytime is very bad and evening it improves, you feel little better vision. That is cataract. Consult a doctor. The opacification of the lens needs removal and replacement with another lens, and your vision can become 6/6 or normal. Your clarity of vision will be phenomenal. So with the changes of the vision acuity during the 24 hours, if you experience this kind of entity, vision is bad during daytime, during sunlight, good during the dark, that is cataract. If your visual acuity is down and you have a headache, it is glaucoma or high pressure in the eyeball plus your vision getting diminished. You should consult an ophthalmologist. They give certain drops and it improves phenomenally. So don't actually neglect this kind of visual problem. Hearing problem also. There are certain types of sensory neural deafness. There are certain types of sensory neural deafnesses which are completely treatable. So whenever you feel that your father, mother, or the elders are having hearing problem, 90% of the hearing problems can be treated by simple hearing aid, which cost you not more than your Bluetooth device of your mobile phone. That can help improve their communication. That will help them improve their quality of life. So hearing aids are very cheap these days. Now those hearing aids which are required in small child, that is cochlear implants, are very costly. I'm not talking about those. I'm talking about sensory neural deafness. So we have covered eyes, we have covered ears. Now, denture problems. Why I'm going to make an emphasis here is people neglect their dental problems. They move with one tooth, fractured tooth, 3 tooths, or only one line of tooth, only one side molar, and they manage their lifestyle. बच्चे को क्यों तकलीफ, बहू को क्यों तकलीफ, उनकी तनख्वाह कम है, लॉकडाउन में सैलरी नहीं है, क्यों खर्चा करने का. लेकिन what happens is over a period of months and years, your digestive system suffers, your digestion suffers, and what happens is a stitch in time saves 9 नहीं रहता फिर. Then you have to go in for 18 stitches, 36 stitches. That means problem increase. Pancreatic disorder, gallbladder dyspepsia, pancreatic dyspepsia, intestinal dyspepsia, appendicular problem, cecal problem, chronic constipation, then tropical sprue, colitis, Crohn's disease, ulcerative colitis. There are 25 to 30 illnesses which are related directly with your chewing apparatus. You'll be surprised and amazed what cardiologist is saying to us. He's talking more on teeth problems also. So as far as possible, try and get the dentures affixed. Help them out with good dentures. There are removable dentures which can be cleaned. There are fixed fixtures which can be kept permanently and can be replaced after 10 years. So give dentures to your parents, give dentures to your all those people who are there at home. Serve them with this denture. Now, after covering this oronasal cavity, we are coming down to lungs now. I have covered up the heart. Lung problems are very common in India. People have problems related to pollutions, problems related to bronchial asthma, problems related to smoking. People have problems related to lack of conditioning of the lung. They don't exercise. We have almost 800 smaller balloons in the lungs, both together. There are smaller balloons which need to inflate, deflate, inflate, deflate. But take it from me, only 1/3 of our balloons or lungs are used optimally by us in day-to-day life. That means we don't use our lungs adequately. To use our lungs adequately, we should recruit more balloons in our day-to-day routine activity. So try and give 10 minutes at least to do certain exercises which will inflate your chest and deflate your chest in such a way which is more than your routine. So I tell people, do this exercise. Inhale with one nostril to the maximum possible, taking good much amount of time, space it over many seconds or even 1.5 minutes. Hold your breath for as long as possible, then release it with another nostril. This will help recruit more and more balloons. Your physical capacity increases with just recruiting more balloons of the lung into ventilation process. Those who can jog should jog. Those who can do various asanas should do. Those who can go for swimming should do. Those who can cycle should do. But people above age of 60, we are talking about, they have this as a routine, simple exercise which they can do it at home. That is Anulom Vilom or breathing exercises or pranayama. We are not using our lungs optimally. That's the reason heart has to compensate. People ask me, doctor, every time I am breathless, but doctor say my heart is good, my lungs are good. Every time I take ECG, ECG is normal. My blood pressure is normal, sugar is normal, but I feel very breathless. The reason for your staying breathless is your physical is deconditioned. You are good to operate in office on a computer. You are good to operate in an office for your office work. But when you are asked to climb staircase, 4 flights of staircase, you become breathless. When you are asked to clean your fan, ceiling, or the cabinets inside the house, you feel breathless. That means if you do certain things which you are not accustomed to, that means your physical capacity is drained down. You should develop more physical conditioning. So do certain exercises wherein at least there will be 20 minutes for yourself, which will include at least 10 minutes of breathing exercise and 10 minutes of some sort of aerobics. It may be little brisker walk. You don't require to be hunter-gatherers. Now, Marvin, before we started our discussion, you were to ask me certain questions. I am going to incorporate this into my easy flow of talk. Human tribe have civilized. We have civilized over a period of thousands and thousands of years. Initially, we were hunter-gatherers. We were surviving on the food which we used to get from the animals. We used to hunt and eat. We used to not grow in the farm. We had no storage. So we used to kill animals. We are not like that now. We have progressed. We have become civilized. We don't require to hunt or run. People sometimes overdo. They go to gym and try to lift heavy weights to impress their peers. They all of a sudden go on some resolution program which they decide to do in the end of the year, in the 30 or especially December, and this resolution ends before 15 January. To impress some colleagues, they join gym, fill in some form and pay 25,000, go to Talwalkars, go to that gym, and 15 days later they come with orthopedic problem, they come with ligament tear, they come with the blood pressure issue, they come with some or the other problems. Don't do that. You're not required to do that. You are just required to do modest activity. See, after age of 40, 50 or 60, you cannot develop dole shole. You are not required to participate into any of the this kind of programs which are like, athlete activities. You are not given a task. You have to live a quality of life. For that, protein-centric diet, drinking good much amount of water, having good 6 hours or 7 hours of sleep, be up on vitamin D3, vitamin B12, vegetables, fruits, seasonal vegetables. Those that love eating non-veg, chicken or fish or egg white is good. Those who are pure vegetarian, all types of dal, paneer, dahi is good. It gives you good much amount of protein. Consume all the seasonal fruits in modesty. Don't take a big patela of mangoes and start eating that mangoes only. You can enjoy mangoes, eating mangoes even if you're diabetic, but it should be like a human being eating that. It should not be a buffalo eating that. We should behave like human beings. People take this much amount of rice in their plate. I tell people that don't consume. I never eat chapati and rice. And I am full on energy to actually work for 12, 13, 14 hours because what is that? The magic behind the good health of those who are enjoying good health is low carbohydrate, more water, more proteins. This makes you feel light and you lose out on fat, weight. You don't get uncontrolled sugars. You don't get blood pressure, cardiac diseases. From today onwards, make a genuine resolution that there are two enemies of mine. I'm going to push them a little aside. Our enemies are not Pakistan or XYZ China. Our enemies are those things which are on our table, your dining table, that is sugar and salt. From today onwards, make a resolution that I'll consume less of sugar, less of salt. Start your day with very less sugar in your tea, or you may take black coffee, black tea, green tea. Start your day with this. Have one whole fruit, have something which is prepared in vegetarian form as sprouts, or you may have a little quantity of carbohydrate-centric diet in morning as a kickstart diet. You may have idli, dosa, you may have uttappa, you may have poha, you may have upma, you may have one chapati, one fulka, some vegetable, one katori dal, porridge, you can have cornflakes, you can have kickstart with some carbohydrate, but afternoon and night diet should not be carbohydrate centric. It should be more protein centric. So what I follow usually is I bring one dabba full of dal, one dabba full of sprouts, and cut fruits, seasonal fruits. It may be apple, pear, it may be pomegranate, it may be papaya, it may be muskmelon, it may be watermelon, anything which you can stuff in tiffin and come to your office. And this should be the only diet. There is generally nothing which is cooked. But if I get something which is cooked, is only sabji, methi ka sabji, palak ka sabji, more of a vegetable stuffed with some dal. So palak masoor, then palak with this dal, palak with that dal, methi with that dal, methi with that dal. That kind of thing should be more in your diet. You can consume more of radish, more of kakdi, cucumber, more of this vegetables or salads. You should have that kind of lunch. Dinner should be very light. It should be like a reverse pyramid meal pattern. Morning you should be Raja-like, afternoon you should be like a common man, and night time you should be pauper, beggar. ऐसे खाने को नहीं ऐसे type का dinner चाहिए हमको. So diet has to be reverse pyramid. Good diet in the morning, modest diet in the afternoon, and very light in the form of soup, or it may be again one katori of any tuvar dal, moong dal, and one fruit or one cup of milk. Don't take very late meals. Try to wind up your dinner before 9:30. Now here are the problems which comes in elderly. They don't have most of the time activities. They don't go out, they don't exercise, they eat their dinner, they don't feel hungry, but as a compulsion, they eat their dinner and they just lie down. Their stomach bag becomes capacious, it develops more atony, the diaphragm becomes more smooth, and it is not a muscle diaphragm anymore after a lack of exercise and after a particular age. It pops up into the chest, and what happens is you develop hiatus hernias, erectations, belching, water brush, vomitings, then digestive system gives way. All these problems they happen because of the bolus bulk meal at night time, masala meal at night time, lying down immediately after meals. You should have at least 90 minutes of time difference in between having your dinner, which is light, less masala. It should not be too much of stuffed meal and going to bed. So this is the mantra of good health. So starting the day with a good meal, it may be some part of carbohydrate, but afternoon and evening should be very less on carbohydrate. Early morning you'll feel hungry. You should feel hungry early morning. Your body, brain should demand glucose. That time you can give. The kickstart has to be with carbohydrate, but maintenance has to be with the proteins. Fat should be less. Then you will feel lighter. Even after having lunch, we can run onto the 6th floor, come back to the OT, come to OPD and all this. This is the actual mantra for good health, what you practice. So this I wanted to touch as a meal pattern to keep yourself healthy. And this is a framework of the diet or meal which you should be following. Now hereafter, if you have any queries, because this topic is completely bizarre, here I have touched certain aspects of your health. I'm going to end up with certain actually other topics which are going to be covering the lower part of the human body, which is important for older people. But in between, if you have any queries, you can unmute and ask me. Now I'm going to come to, there are certain diseases which can present in a silent way. Kidney disease, prostate disease can present in silent way. Intestinal diseases can present in silent way. But you have to be vigilant. What is the vigil which is expected from you? If your father or if any person, mother or anybody is having black color stools, kali kali sandas potty ho rahi hai, that means a person is losing blood in the upper GI tract due to, and it will be very gradual. They will not share with you, oh no, I have had some iron tablet, I'm in black color stool. Oh no, I had palak paneer, that's why I'm black stool. I ate chicken, so I'm in black stool. They will try to find out answer by themselves, but which may not be the fact. So try inquire. If there is consistently more than 7 days of black color stool, that means your parent or one who is actually suffering from this is losing blood. So this is a silent problem which may present late in a form of very complicated state, very low hemoglobin, and there could be major ulcers in the GI system, even cancers of the esophagus or food pipe, or cancers of the stomach bag or duodenum. Now there can be a presentation which our parents, those who are above 60, they neglect. Oh, this is just a part of aging. What is that? I go to washroom every 6 to 7 times a day and at night time. You must be seeing your parents getting up, father getting a male, especially I'm talking about male gender. They get up every half an hour, 1 hour, every half an hour, 1 hour to go to the loo, pass urine. This may hamper their sleep. This may cause problems. Now there is a reason underlying for this. They think that this is all aging, but there is a aging plus other pathology which is troubling them, that is called as benign enlargement of prostate. This should be attended. This can be medicated. This can be treated, and this can be put on stall, and person can have good quality of life and reversal when actually treatment is started earlier. Now I tell people, those who are above 60, 70, that you should not be having too much of frequency of urination at night time. There are medicines. Get a sonography done to assess the prostate size, to assess the residual urine after emptying the bladder in the bladder, to assess your blood for serum prostate specific antigen. So sonography giving the prostate size, sonography giving the residual urine quantity, then a blood test called as serum PSA level, which can be a marker of prostate cancer. So I tell people, I'm a doctor, but I lost my father because of this. He used to stay at Aurangabad. We are 6 doctors in the family, but we could not diagnose that. So I feel very bad and tell people. I used to tell my father that get investigated, get investigated. These are our parents, they don't listen. Oh, nothing better. This is just age related. I'm drinking more water. I'm drinking milk while you go to bed. That's why I'm having more urination. So be attentive to your parents. If they are losing out weight, if they are having black color stools, if they are having increased frequency of urination, then problem can be related to their bowel, intestine, stomach, esophagus, GI tract. Frequency of urine with weight loss, prostate issue. It can be prostate cancers also. So these are very common. Now coming down, bone diseases which present in knee joint and hip joint. These are very common. We all age. I'm going to age. Today I'm 50, but I'm going to at one particular day become a 70-year-old man. If God is having his own grace on me, he showers grace and you all bless me, then I can survive 70. Otherwise, I don't know, we'll live under a lot of stress. So this is my stress buster actually getting connected to, I was telling Vikas and Marvin, that getting connected to me helps de-stress me, unwind me. So you all also should have de-stressing modalities. You may observe anything nonsense channels like Tom and Jerry, Mickey Mouse show, Spider-Man, anything cartoon show on your televisions for certain number of minutes, not all throughout the night. Don't watch movies and Netflix series all throughout the night for hours together. So you should set in some screen time. So this will be my 30 to 40 minutes of screen time. where there will be some news, some entertainment, news and entertainment. This is important. Now, when a person gets problem with the lower limb, especially knee joint and hip joint, they try to neglect, and it is okay to neglect in the initial phase the bone problem. But when a person gets a difficulty in walking, weight bearing, that means we say that the osteoarthritis or the affection of the bone joint disease has progressed to such an extent that they require medical help. If your parents are getting with great difficulty, or they are trying to avoid getting up, if they find it getting very difficult to get up and they shake like this, that means they are having hip joint problem. And once they get up, but they find it very difficult to initiate the walk, that means they are having knee joint problem. Getting up is a hip joint problem, and after getting up, walking and initiating movement is a knee joint problem. There may be associated neurological disease like Parkinson's disease, some dementia, which are all treatable. If your father is having this kind of presentation, tremors of the hand, especially this kind of tremors, this is called as senile tremors or Parkinson's. It can be treated. If a father is having rigidity like this, if their movements are rigid like this, if they shake when they pick up some object, this is all treatable. Senile tremors, Parkinson's tremors, you have good medicines like Syndopa Plus, which can make them completely fit, and tremors, they go away. So treatment of Parkinson's, treatment of senile tremors, treatment of hip joint problem, treatment of knee joint problem will give them good quality of life. They should not reach this stage where they require the joint replacement. But of course, these are also good modality of treatment after age of 65, 70. Suppose medicines, calcium, D3, soft painkillers don't help them and they get agonizing pain, then the orthopedician can give them good revamp of their joint by replacing their joint. So that is called a joint replacement. So the orthopedician can make their miserable life into good life if they get a good orthopedic treatment or orthopedic consultation and treatment. So we have covered different aspects of human body. There are certain neglected aspects of vision, hearing, dental problem, GI problem, prostate problem, joint problem, which I wanted to touch base. Now, there are people who come to us and they appear very pale. If you look here, they are completely whitened, ashen pallor. They are having less hemoglobin. They are nutritionally depleted. Their iron intake is barely anything. They don't consume green leafy vegetables. They just eat little soft chapati and dal rice, soft chapati, dal rice, soft chapati, dal rice. This is their diet, because they feel that, oh no, my children should eat good diet. I am old, I am, and what is say, a burden on them. So they neglect their health. So you should start them on easy pills like iron pills or folic acid pills or B complex pills for your parents. Calcium pills, they are available, D3 pills. All those who are staying indoors should be given vitamin D3, whatever actually age group you belong to. We all should take vitamin D3 once a week, 12 capsules. That is every week. Everybody of us should take. I am following that for past 15 years. Every week I take, in January, February, I complete that course. I take every week one vitamin D3 capsule, and simultaneously I take vitamin B12 because I'm a pure vegetarian. So we get deficiency of vitamin B12. It is not that those who enjoy eating non-veg, they shouldn't eat, but good cooked meat, that is white meat, lean meat, which is more in protein and less in fat. Fish, egg white, and chicken is good. Don't eat red meat. Don't eat goat meat. Once in a while is fine, but red meat is of course no from the medical science perspective. This will keep you healthy. But drink a lot of water. You should consume at least 3 to 5 liters of water. Every now and then youngsters should go to washroom. I see people working in AC office, they barely go to washroom. They barely drink water. So we have this kind of bottles in our room filled every 2-3 hours. So me and my subordinates, we drink water. We see to it that we tell each other we drink a lot of water. The ocular problem, dehydration of the skin, then problems related to your moisture in the eyes, problems related to your constipation, they all come because of the lack of water consumption. Stone formation in gallbladder, then stone formation in your urinary system, they are all related to lack of water. Complex stones, which they are formed over a period of decades, they are all because of consumption of less of water for years together. If you consume good quantity of water, every time you flush out, you don't develop calcium and oxalate stones. Consumption of calcium is not related to development of stones. This is an important message. People say that, doctor, you are giving calcium. I already have kidney stone. There is no correlation of consumption of calcium and development of kidney stone. There is no correlation of consumption of calcium and development of gallstones. The calcium stones which are formed in the kidney and gallbladder are unrelated to dietary calcium. These calcium stones are developed by the metabolism because you are deficient in D3 and calcium. So this is a paradox. You are deficient in calcium and D3. Your bones are getting washed off with your calcium and D3, and that is coming into your circulation. Stone formation happens more in deficiency of calcium and D3. So this is a paradox. You should be consuming more of D3 and B12 and calcium. So these are certain take-home messages which I wanted to give you all. I didn't want to come out with some PowerPoint presentation which is like stochastic or premeditated discussion which doesn't give any take-home messages. For elders, you should be very careful in between 11 p.m. to 7 a.m. When you are getting up because of some or the other issue early in the morning or midnight, you should get up very gradually. Suppose you are sleeping, you should sit first on the edge of the bed, prepare your body, move your hands, move your neck, come in the perfect senses. You don't wear specs also at night time. Prepare your body, wear your specs properly. Then once you're in full senses, your room is enlightened, get up and walk towards the washroom. You take 2 to 3 minutes. This 2 to 3 minutes, whatever happens, you don't rush to washroom. Nothing happens. Nobody is going to put you in jail if you pass urine in your clothes. Nobody is going to punish you for that. You are our father, you are our mother, you are parents. Nothing happens. But if you don't take precautions for 2 to 3 minutes, we have seen people fall, they go in bathroom and they develop syncope, they develop micturition syncope, they develop head injury, they develop fractures of hip joint, they develop femur fracture, they develop shoulder fracture, they develop subdural bleed, intracranial hemorrhages, ocular hemorrhages, and whatnot. A simple 3 minutes care can prevent all this trouble. So 11 p.m. to 6 a.m. you should be careful. Use 3 minutes of preparatory mode of your body. Get your body in perfect senses. Wear your specs. Enlighten your room and then only walk. Do not latch the door from inside. Nobody will come at that time and watch what you're doing. Don't latch the door. Keep it open. Keep it just pushed. And after doing all that job, you can come out and again getting up from the toilet seat. Don't do everything hurriedly. Just take your time again. Hold something and get up slowly. These all movements should be very slow. Sudden getting up after evacuating your bladder reduces your blood pressure and you can get a syncope. Syncope is the blackout where you are just off sense and you pass away. People get up after a few minutes, they don't tell the children. Early morning at breakfast table, your father or mother is with black eye. Oh, nothing better, nothing happened. I just hit the wall, I just hit the cupboard. They don't tell the facts. So this syncope may repeat, that may come again and again. It is better that you recheck with the family physician or a doctor that there is no other underlying illness also. Your medications are not inapt. Sometimes, the requirement of the blood pressure medicine comes down after good diet, salt restriction, and your medicine pattern is the same. You have not followed. Your blood pressure is coming down. You have to reduce the medicine under the medical consultations. There are medicines which we reduce gradually if you develop syncope, if you develop micturition syncope, if you have blackout, fainting episodes, we require to reduce medicine, but people don't follow. Now people develop black and purple bruises all over the body at particular age. There are people who are on blood thinners for compulsory reasons, for stroke, paralysis, for kidney disease, heart disease, for peripheral vascular disease, for angioplasty, bypass status. Blood thinners are a must. But after age of 65, 70, we reduce the blood thinners to a less quantum. So these blood thinners are reduced under the medical radar. If you are developing black and gray bruises, this kind of purple bruises, everywhere over the body, even if your skin is pinched like this, that means there is a time to reduce the blood thinners under the medical consultation. Some medications are required to be changed after a particular, people after getting a treatment done, consulting a doctor, they don't consult for 5, 10 years. Oh, I'm good. I'm okay, I'm managing. But you should know your scales, digits time to time. You should know your weight, you should know your blood sugar, you should know your creatinine, you should know your sugar, you should know your parameters. So it is better that you, if you are having diabetes, hypertension, kidney disease, low hemoglobin, angioplasty done, bypass done, prostate surgery, any surgery done, timely you just get simple digits known. It doesn't require a lot of money, but it just requires one consultation with your GP. That general practitioner, family doctor can pick up, help you, put you into the right track. You don't have to rush to a super specialist for that. You don't have to come to a cardiologist. You should just consult your general practitioner. So these are important messages. Tell your parents to be careful in between 11 p.m. to 6 a.m. And they should be up on protein, up on vitamin D3, B12, having good protein-centric diet, should be eating seasonal fruits. You don't have to eat almonds. You can just eat seasonal fruits. You can eat shengdana, simple poor man's proteins. You can eat nuts. You can eat chana futana also. That can give splendid quantity of proteins. So proteins can be in the form of sprouts or all the types of dals. You don't require rich man fruits or whatever they eat. Even our routine, daily routine is sufficient. We were really in good state as a country in the 70s and 80s because our diets were millet centric that time. But this is what has actually replaced our millet is wheat and corn flour, which is bad. Time has come to go back to millets, bajra, ragi, all that is healthy. So all these things which are healthy have come out of our diet plate. It is time to go back on all this good old school of thoughts, millets, and see your life expectancy again becomes 85, 90 like Japanese people. We all Indians can also live age of 85, 90 easily. I mean, people can live up to age of 100 also. Those who are genetically blessed, they can live up to age of 100. But those who have strong family history of heart disease, mother, father suffering from heart disease at a young age, undergoing angioplasty, bypass at a young age, they also can have a good quality of life if they take due care, if they follow good diet, if they consult doctor, if they start timely medications, if they control the risk factors. When a father or mother is having heart disease below age of 55, 60, that means it's a strong risk factor for the second lineage. Their children should be more cautious. It is not that just cholesterol causes problem. Blocks are the problems which develop in the form of blocks in the vessels of the heart or brain causing stroke can be also because of the other factors. So we should pay attention on the other factors. Now it is almost 6:30. I have tried to cover up most of the topics of interest, which is of interest to the people above 60. But if there are any questions, I welcome all those questions and we can take them ahead. Over to you, Vikas.
Yes, thank you, Doctor. Dr. Surase, thank you so much for imparting so much of information to us, not only about heart health, but also in general what we are supposed to do. I think you must have at least given us about 50 to 60 tips. I think I'm going to compile all of this and share it with all our members so we can register it and also follow it, because listening to you was great and that's always a pleasure. But we are also going to make sure that all of our elders implement it. So as a part of Khayal members, we also go ahead and monitor all their, their weight, their blood pressure. And if we find any changes, too many changes in the parameters, we try to take preventive measures. Like you said, all of these are preventive measures. If we keep on doing it, we will hopefully, nothing, we don't go into some health issues later on in life. So that is what we always do at Khayal. So it's open now to members. If you would like to ask any question to Dr. Surase, he'll be more than happy to go ahead and answer those questions. If you want to chat, you can put it up in the chat. Otherwise, you can also go ahead and unmute yourself and ask a question.
Doctor, I would like to know, you said no chapatis and no rice.
If you're eating brown rice, if you're eating unpolished rice, if you're eating less quantity of rice, that's fine. Kerala rice is good, brown rice is good. But if the rice is your staple diet, then you can consume. But as far as possible, be less on carbohydrate. Those who are eating good fish or high protein content with rice, it will negate the possibility of you going up on sugars and high carbohydrate, because your bulk is formed by fish, chicken, or some other item which is high on protein. I recommend personally that it should be less chapatis and less of rice, less potatoes. It should be more on dals.
And even no yellow of the egg. It's going to be white.
See, it should be primarily egg white, but growing children should consume more of egg yellow, and very elderly citizen after age of 75 can consume one egg yellow. No problem.
One.
Yeah, because for
One.
nervous system functioning, you require certain fat. These are the sphingomyelins, which are for nervous facilitation. If you are having burning in the leg, if you are having neuropathies, you can consume one egg full yellow.
Thank you.
You should consume more of calcium, D3, omega-3 fatty acid, B3, B6, B12 after age of 70s. But if you eat rice as a staple diet every day, the quantum of rice should be less, more of a sambar, more of a dal, more of fish, more of a chicken.
Small liters, yes, small liters.
Yeah, it is okay to have rice, but the quantity should be less.
Quantity should be less, yeah.
There is one question in the popping up desk, that is blood pressure 150, 60 okay? See, for people above 70, 80, don't try to bring your blood pressure, which is mentioned in books, to that range. 120 by 80 is the book normal, pulse rate of 72 is book normal, which our books have taught. The scales are different for different age. You are just okay with the blood pressure of 150, 160 at the age of 75, 80. If you try to bring blood pressure too low to 120 by 80 or so, you may feel more giddy, and your blood pressure falling to that low level may hit your brain and may affect your brain by strokes. So scales are different for different age group patients. And for sugars also, after age of 70, 75, don't bring your sugar under very tight control. You don't require to chase any HbA1c target. You just require to live longer. So maintain your HbA1c in between 6.5 to 7.5. That's fine. For youngsters, we try to bring it below 6.5. But we are happy if the average sugar remains in between 150 to 200 for senior citizens.
Okay.
Don't consume.
Yeah, continue.
I recommend not to consume painkillers, which are very dangerous for kidneys and stomach bag for elders, like ibuprofen, combiflam, Voveron. There are soft painkillers like Dolo, Calpol, Tramadol. You should ask for soft painkiller which will not affect your kidney, because you never know, on one particular bad day the kidneys may show or present. You may find that everything is fine, everything is fine, everything is fine. On one particular bad day in a calendar, all of a sudden kidneys are appearing failed because of the consumption of long-term painkillers, steroids for joint pains and your back pains. You are happy treating back pain yourself, but that is firing your kidney. You feel relieved taking injections from a general practitioner, not telling them that your kidney creatinine is high, may affect your kidney. So try to take painkillers which are kidney friendly and stomach friendly. Ask for those if you are meeting your general practitioner.
Doctor, there's also one question. We have one of our members, Fatima Lobo. She's asked a question that, is it okay for them to do intermittent fasting? Is it good? Especially
yes.
Look at the point of view of elders. Is it good?
Yes. Yeah, those who are having diabetic medicines, they should be having these as a low-key affair, because it is not going to help them. If you go on a very crash diet in a diabetic person, the diabetic medicines should also be reduced. If you are doing fasting, the diabetic medicines should be also modified. So it should happen under a medical radar. No problem. You can do fasting. So all the religious faiths support this. May you take Muslims, may you take Jainism, may you take Hinduism. So all this they support, and it has come from the old times, from Vedic Kala also, from all the good thoughts, good teachings. That Ramzan they do rosas, we do Shravanas, people do some particular 40 days of fast in all the religions. So this is body cleansing. I also do that from 9th of this next month, 9th of August to 21st of August. I'm going to follow certain particular curriculum about the diet, detoxifying the body. This is your way of looking at your health. You can do that. Intermittent fasting is very good. All the science and scientific books are supporting that, and it helps control of diabetes, lose out weight, and also management of your blood pressure.
Dr. Surase, also any post-COVID precautions that we need to take? Fatima Lopez also asked this question.
Generally, breathing exercises, be up on proteins, do breathing exercise. That's the first important message. But if you have any medical complaints, then not to take anything in your own hand. Don't sit in a driver's seat for managing your own problem. Better consult a doctor. Doctors will give you simple remedy to solve complex problems. And these remedies of 1 or 2 weeks can help save you from very difficult situations like pulmonary embolism, strokes, heart attack. So it is under the medical consultation, you can take aspirin, some rivaroxaban, some warfarin, dabigatran, all these types of medicines. Doctors will prescribe you considering your clinical status, and they will give you medicines to prevent complications.
डॉक्टर, मला एक प्रश्न विचारायचा होता.
Yes,
हॅलो
Ravi.
हॅलो.
हा, मला ऐकू येते.
हा, ते पायात गोळे कशामुळे येतात आणि गोळे येण्याचा आणि त्या हार्ट प्रॉब्लेमचा काय संबंध आहे का?
हृदयाच्या आजाराकरिता जर तुम्ही रक्तातून युरिन फॉर्मेशन होऊन लघवी जास्त व्हावी याकरिता औषध घेत असाल, त्याला म्हणतो डायुरेटिक्स, लॅसिक्स, डॅटॉर, फ्रुसिलॅक, लॅसिलेक्टोन, तर त्याच्यामुळे क्षार द्रवण कमी होतं शरीरातलं, सोडियम पोटॅशियम कमी होतात आणि क्रॅम्प येऊ शकतात. नंबर 1. नंबर 2, आपल्याला ॲटोरवास्टॅटिन, रोजुवास्टॅटिन नावाचे चरबी कमी करण्याची औषधं चालू असतील तर त्यांनी देखील क्रॅम्प्स येऊ शकतात आपल्या पायाच्या काफ मसलमध्ये, थाईजमध्ये. नंबर 3, कधी कधी पायाच्या रक्तवाहिन्याच्या आतून रक्ताचा प्रवाह हा खंडित होतो, कमी होतो, तर त्याच्यामुळे पण आपल्याला क्रॅम्प्स येऊ शकतात. नंबर 4, एक्झॉशन, फटीग, याच्यामुळे देखील आपल्याला पायामध्ये क्रॅम्प्स येऊ शकतात. पण आम्ही जेव्हा 5 मिनिटात बघतो तर पटकन कन्क्लुजनला येऊ शकतो. त्यामुळे तुम्ही एखाद्या डॉक्टरला कन्सल्ट करून तुमची मेडिकल रेकॉर्ड घेऊन ते हिस्ट्री सांगून मेडिसिन्स काय घेतात ते सांगून तुम्ही डायग्नोसिस वरती पोहोचू शकता. समजा डायग्नोसिस मध्ये काहीच नाही मिळालं, जस्ट कन्झ्युम ॲज अ बेनिफिट ऑफ डाऊट कॅल्शियम अँड B12 अँड D3, एक कोर्स महिन्याभराचा. देयर इज नो हार्म. आय होप यू अंडरस्टँड मराठी, ऑल ऑफ यू. So in short, those who get cramp should consume more of D3, B12 and B3, B6. Also consume calcium. There are certain reasons, sometimes medicines, sometimes blocks in the leg vessels, sometimes exhaustion, fatigue. This could be the reasons.
Doctor, also one question that to get vitamin D3, okay, we also get it naturally through the sun rays. So how much time do we need to spend in the sun? And of course, we will have to kind of not wear full sleeves, because I'm guessing that we were designed to, roam without any clothes back then, and we were getting all the D3, on naturally. But now, how long should we go out in the sun?
See, our forefathers were working in field. They used to get natural vitamin D3. We are not working in field. We are living in these skyscrapers inside the 4 walls, air-conditioned chamber, moving in automatic cars, not using the staircases. So the ideal time is in between 9 to 10, exposing yourself to sunlight, and you should consume more water. Our body is not tuned to take up any sunlight. Actually, we have lost that habit of staying outdoors in the sunlight. The ideal time is of 25 to 30 minutes in between 9 to 10 a.m. And this should be at least 5 days in a week. And you require at least 180 days of exposure to this kind of light to manufacture 2 units of vitamin D3. So if your vitamin D is 10, to become 12, you have to spend 180 days.
So I think
it is a Herculean job. Yeah, you're going to get more D3 by taking capsule, Uprise D3, calciferol, or whatever you may, whichever pharmacological preparation you may take. But that was good when our forefathers were working in field. They did not require any vitamin D3. But now we require this. We have to take.
That's good. So science to the rescue again.
Yes, science to the rescue again.
Okay. Also, like one very important point you had put up, like how we got rid of Pluto as a planet. I think we should get rid of potato as a vegetable. I don't think it should be counted. Like you said, the potato is not a vegetable. Green leafy vegetables or cruciferous vegetables.
Yes, all of you, I request you not to consume sugar, even if you are not diabetic. You see the change over a period of 1 month. You will feel so light, energetic, and you'll start singing. You'll find the difference within 1 month. Less salt and less sugar. Initially, you'll feel craving for biscuits, chocolate, ice cream, pizza, burgers. But once you develop habit, you start feeling guilty even to look at them.
That's great. That's great.
Oh, this is not meant for me. Let somebody else enjoy. This is not for me. This is going to get disease along with it. And take it from me, Even if I see this kind of food stuff besides me, somebody eating, I don't feel, oh, I feel sorry for that person. Oh man, this is a buffalo or cow food, something like that. I feel this is not meant for human beings.
Okay. We'll try. Doctor, we have also putting a lot of efforts in terms of nutrition for our members. We have Prachi. She's a nutritionist. So we also make special diets, of course, consulting with the doctors, and we give it out to our members so that we make sure that they are, having a very healthy diet all the time. Uh, like you said, how they need to follow it is totally up to them. If there's a pizza or a burger or some chips next to you, you need to kind of go ahead and make peace with it and then go and have healthy.
Yes, of course. See, eating all this is not a crime, but punishing your body with this repetitive is a sin. I think, you are torturing your body. You can have once in a while, if you're on outing, if you're on social function, if you are having celebration, you can eat ice cream, chocolates, no problem. But not on regular basis. People are in habit of eating sweet dish every day as a delicacy, which I think even if they are consuming in a less quantity, it is not required by our body, because all those things, natural ingredient which we are eating, give ample sugar to us, ample salt to us. No to Chinese items in form of cooked Chinese items. No in the form of packed food. I tell my patient not to eat crap. CRAP. Canned drinks, Pepsi, Coke, Maaza, Mirinda, all these contain very high sugar. R for refined sugars in pastries, cakes, all those things which are given in bakery contain lot of refined sugar. A is artificially processed food like Haldirams, then potato bhujiyas, moong bhajiye, the potato chips, onion chips, this Lays and kurkures and all that. And packed P is again like biscuits and all, packed food, processed food and packed food. This P is for processed and packed food. Crap. So again, carbonated aerated drink for C, R for refined sugar in the form cake, pastries, A for artificially processed food, and P for packed foods. Store foods in the refrigerator should not be eaten 24 hours beyond. If they are frozen, then you should check that there is no rancidity. They are not spoiled. You can consume. But as far as possible, eat or drink whatever it is freshly prepared by you. Nimbu sarbat, chas is very good. Why to go in for Pepsi and Coke? Serve your guest with Nimbu sarbat and chas. That is the best drink. Make a habit of consuming black tea, black coffee.
That's great.
Doctor, can we take green tea in empty stomach?
Yes, why not? It is an antioxidant. It doesn't cause acidity. Take it from me. If you add little lemon, it doesn't cause acidity. I consume almost 5 to 7 small cups of black tea with lemon in the hospital.
That's okay.
5 to, and more energetic you feel. You feel more alert and more attentive and focused. You may have 2 or 3, you may have 4 or 5, depending on your needs.
Okay.
Doctor, I also wanted to know this trend about having apple cider vinegar with water before your meals. Is it advisable? Does it have any advantages?
So there are different types of appetizers. There are different types of probiotics which are marketed, but better not to fall into the trap of marketed things. Prepare your own formula at home. Every indigenous family has its own high protein diet, more of probiotic in their diet. You can go in for different items which your mother makes. Those contain more of proteins. You don't require all this apple cider vinegar, all that. These are all artificial. They contain more of allergen. They contain more of what we say is those products which will increase your triglyceride. These are also, they are high in quantity in beer, alcohol. I'm forgetting that chemical name. Arginine. Arginine and phosphates. They increase more of a joint problem, cartilage problem, more uric acid, more triglycerides, and they cause more problem. Why to consume all this? They are after all chemicals.
Right. So, okay, we have a last question if anyone wants to ask now. and we will release doctor because I'm sure he's waiting to go ahead and do his other surgeries. In fact, doctor, we have gone beyond our time because it was a pleasure speaking to you, and we really enjoyed listening to all the things that you had to tell us. Anybody has a last question to ask? Okay, so
one question, 1 minute.
yes, go ahead, Mr.
Yeah,
Gopalan.
yes, high creatine level leads to heart attack.
See, there is no direct correlation, but high creatinine means your kidneys have
Kidney.
partly got affected. Now, if your creatinine is staying persistently above 1.5, that means your kidney filtering capacity has come down by 50%. So get it checked. Avoid painkillers, avoid dehydration, avoid certain medicines which will insult your kidneys more. Avoid self-diagnosis by using more of a radiation, using more of a radiated diagnosis, using more of a contrast. It is better you consult. Kidney creatinine going high means your blood pressure will also come up with that. Blood pressure coming up may affect heart. So it is indirect correlation. Kidney, heart disease coexist together, but both are mutually exclusive of each other.
Dr. Surase, also, I would like to ask you, since this is the pandemic and we are all in a sort of a lockdown, especially for the elders who are about 60, and it's not safe for them to go out, how much exercise should we do on a daily basis to keep ourselves regulated with good health?
20 minutes of exercise is enough. You may do beyond that also, but to attain a good actually caloric combustion and to actually do good stretching and breathing exercise, you require at least 20 minutes to make your body feel agile and active. So in that 20 minutes, you can have 5 minutes of yoga, 5 minutes of pranayama, 5 minutes of kapalbhati or anulom, and just 5 to 7 minutes of brisk walk. That is enough. You don't require to jog 21 kilometers to keep yourself fit. You don't require to do half marathon, full marathon. Those who do half marathon, full marathon, those also suffer from heart attack.
Heart attacks.
We are not meant for that. Don't overdo. We have to. We are intellectual people. We have to live longer and live healthy and happy.
Healthy.
Yes.
That's great. So thank you so much, doctor, for all the time that you spend with us. I'm sure all the members enjoyed it, and we would
Yes.
really see when we can go ahead and connect again. And we would like to talk to you again whenever you can get time out of your busy schedule. We will contact you. Otherwise, if we want to go ahead and meet you, any of our members want to go ahead and meet you, where can we find you?
See, I'm available full time in Jupiter Hospital. Full time is a decent time from sunrise to sunset.
In Thane,
Jupiter Hospital, Thane. Yes.
Oh God.
We are strategically located besides this Viviana Mall. Rather, Viviana Mall utilizes our name as a location geographical landmark because we came before that, a decade before that. And Jupiter Hospital is the only tertiary care center in Thane district, so everybody knows it. So those who are living on Mumbai side or far away, Jupiter Hospital is a strategically located hospital on the highway. Reaching from Mumbai, I stay at Dadar. I reach here in 40 minutes. I've been practicing in Jupiter Hospital for 14 years and traveling day and night. 1400 times I've come in night times and done emergency angioplasty. So on the record, I have reached hospital 1400 times and did night angioplasties, driving my own self.
Wow. That's great. That's great.
He is healthy and happy.
Yes.
Yes.
Yes, Mrs. Lorna. All right. So thank you so much, doctor. It was a great pleasure, and
Yeah.
we'd like to connect with you again. We would like, from all the members at Khayal, we would really like to thank you, especially since you have such a busy schedule, another 3 more surgeries to go after you talk to us. So all the best for surgeries, and hope to catch up with you very soon.